Hello everyone and welcome back to the channel. Vitamin D has become one of the most talked about nutrients in modern medicine. Some people describe it as a miracle vitamin. Others believe it can prevent infections, cure autoimmune diseases, reduce inflammation, improve your mood, strengthen your bones, and even help you live longer. If you've searched online, you've probably come away more confused than when you started. One website tells you that everyone should be taking high doses every day, while another suggests it's only important for bone health. So who is right? Well, in today's video, I'm going to explain exactly what vitamin D does, how it affects your immune system, whether it really helps people with autoimmune diseases, who should be taking supplements, how much you should take, and whether it's actually possible to have too much. As a consultant rheumatologist, vitamin D is something I discuss with patients almost every day. It's one of the commonest blood tests we perform and one of the commonest supplements we prescribe. But despite its popularity, there are still many myths surrounding it. So let's separate fact from fiction. One of the first things that surprises many people is that vitamin D isn't really just a vitamin, it's actually more like a hormone. Unlike most vitamins, which come primarily from the food we eat, vitamin D is produced naturally in our skin when it's exposed to sunlight. Specifically, ultraviolet B rays from the sun trigger a reaction in the skin that leads to vitamin D production. That vitamin D is then processed by the liver and kidneys into its active form, which is used throughout the body. Although we can obtain small amounts from foods such as oily fish, egg yolks, and fortified cereals, it's actually very difficult to get enough vitamin D from diet alone. That's one of the reasons why deficiency is so common, particularly here in the UK where sunlight is limited for much of the year. Now, when most people think about vitamin D, they immediately think about bones, and that's completely understandable because that's the role we've known about for decades. Vitamin D helps your body absorb calcium from the gut. Without enough vitamin D, your body struggles to maintain healthy calcium levels, which means your bones gradually become weaker. In children, severe deficiency can lead to rickets, while in adults it can cause osteomalacia, a condition where bones become soft and painful. Patients often describe aching bones, muscle weakness, fatigue, and difficulty climbing stairs. I've seen many patients over the years whose symptoms have improved significantly simply by correcting a severe vitamin D deficiency. But here's where things become really interesting. Scientists gradually realized that vitamin D receptors weren't just found in bones, they were found throughout the body, including on many of the cells that make up our immune system. Suddenly, vitamin D wasn't simply a bone vitamin anymore. It appeared to play an important role in regulating our immune system. Now, one phrase you'll often hear is that vitamin D boosts immunity. Personally, I don't actually like that phrase. Your immune system isn't like a car engine that simply performs better if you keep pressing the accelerator. In fact, if your immune system became too active, that could actually be harmful. That's exactly what happens in autoimmune diseases. Conditions such as rheumatoid arthritis, lupus, psoriatic arthritis, and vasculitis occur because the immune system becomes overactive and starts attacking healthy tissues. So rather than saying vitamin D boosts the immune system, it's probably more accurate to say that vitamin D helps regulate the immune system. Think of your immune system as an orchestra. Every instrument has to play at exactly the right time and at exactly the right volume. If one section becomes too loud, the music no longer sounds right. Vitamin D appears to help keep that orchestra in balance. It supports parts of the immune system that fight infection while also helping to prevent excessive immune activation that could potentially contribute to autoimmune disease. That distinction is incredibly important. Now, one of the commonest questions I hear is, can vitamin D prevent autoimmune disease? It's an excellent question, but unfortunately the answer isn't quite as simple as many people would like. Researchers have consistently found that people with autoimmune diseases often have lower vitamin D levels than healthy individuals. That's true for rheumatoid arthritis, it's true for lupus, it's true for multiple sclerosis, it's true for inflammatory bowel disease. But here's the important point. Just because two things occur together doesn't necessarily mean one causes the other. For example, patients with rheumatoid arthritis often spend less time outdoors because of pain and reduced mobility. Patients with lupus are frequently advised to avoid excessive sunlight because ultraviolet light can trigger disease flares. Both of those factors naturally reduce vitamin D production. So we have to ask ourselves an important question. Did low vitamin D contribute to the disease, or did the disease lead to low vitamin D? The honest answer is that it's probably a combination of both, and researchers are still trying to understand the relationship. Another question patients ask is whether taking vitamin D supplements can reduce inflammation. Again, the evidence is more nuanced than many headlines suggest. Some studies have shown modest improvements in inflammatory markers or disease activity in certain groups of patients, while others have shown very little benefit. At the moment, we don't recommend vitamin D as a treatment for rheumatoid arthritis or other autoimmune diseases in the same way that we recommend medications such as methotrexate or biologic therapies. Those medications have been shown to modify the disease process itself. Vitamin D should be viewed as an important part of overall health rather than a replacement for established treatments. And I think that's a really important message. If somebody tells you that vitamin D alone can cure rheumatoid arthritis, lupus, or another autoimmune disease, there simply isn't good scientific evidence to support that claim. However, if you have a vitamin D deficiency, correcting that deficiency is absolutely worthwhile. You'll support your bone health, improve calcium absorption, and in many patients, you'll also improve muscle strength and reduce symptoms related to deficiency. What about infections? This became a huge topic during the COVID-19 pandemic. Many people started taking high-dose vitamin D in the hope that it would prevent coronavirus or reduce the severity of infection. Vitamin D certainly plays a role in normal immune function, and some studies suggest that correcting vitamin D deficiency may reduce the risk of certain respiratory infections, particularly in people who are genuinely deficient. But once again, the evidence doesn't support vitamin D as a miracle supplement that prevents every infection. The biggest benefit appears to come from correcting deficiency rather than taking increasingly large doses when your vitamin D level is already normal. And that's something I see quite often in clinic. Patients arrive taking 10,000 or even 20,000 international units every day because they've read online that more must be better. Unfortunately, biology doesn't work like that. There comes a point where taking more vitamin D doesn't provide additional benefit, and in fact, it can become harmful. Vitamin D is one of the few vitamins that can accumulate in the body. Excessive amounts may lead to high calcium levels in the blood known as hypercalcemia. Symptoms can include nausea, constipation, excessive thirst, kidney stones, confusion, and in severe cases, kidney damage. So although vitamin D deficiency is common, vitamin D toxicity is also something we occasionally see, particularly when people take very large doses for prolonged periods without medical supervision. So how much vitamin D should you actually take? Here in the UK, the NHS recommends that most adults consider taking a daily vitamin D supplement during the autumn and winter months when sunlight isn't strong enough for our skin to produce adequate amounts. People at higher risk of deficiency, including those with darker skin, individuals who spend very little time outdoors, or those who cover most of their skin for cultural or medical reasons, may benefit from supplementation throughout the year. If blood tests confirm a significant deficiency, your doctor may prescribe a much higher replacement dose for a limited period before switching you to a maintenance dose. One question I hear surprisingly often is whether everyone should have their vitamin D level checked. In reality, not necessarily. If somebody is healthy, has no symptoms and no significant risk factors, routine testing isn't always required. However, testing is certainly appropriate in patients with suspected deficiency, osteoporosis, recurrent fractures, malabsorption conditions, certain autoimmune diseases, or persistent musculoskeletal symptoms. It's about testing the right people rather than everybody. Before we finish, I'd like to address one final myth. Some people believe that because vitamin D is natural, it's automatically harmless. Natural doesn't always mean safe. Even water can become dangerous if consumed in extreme amounts. Like almost everything in medicine, vitamin D is about balance. Too little isn't good, too much isn't good. Our goal is to achieve healthy levels, not the highest possible levels. So if you remember nothing else from today's video, I'd like you to remember these 5 key messages. Firstly, vitamin D is essential for healthy bones, muscles, and normal immune function. Secondly, vitamin D doesn't simply boost your immune system, it helps regulate it. Thirdly, low vitamin D is common in people with autoimmune diseases, but correcting deficiency is not the same as curing the disease. Fourthly, more vitamin D is not necessarily better. Taking excessive doses can actually be harmful. And finally, if you're worried about your vitamin D levels, speak to your doctor or rheumatologist before starting high-dose supplements. The best treatment is based on your individual circumstances, your medical history, and where appropriate, your blood test results. I hope this video has explained why vitamin D is such an important part of our health, while also clearing up some of the myths that surround it. It's a fascinating area of medicine and research continues to evolve, but one thing is certain: vitamin D plays an important role in keeping our bodies healthy, even if it isn't quite the miracle cure that some people claim it to be. If you've enjoyed this video, please give it a thumbs up, subscribe to the channel, and share it with anyone who wants to better understand vitamin D, the immune system, and autoimmune disease. If there's another rheumatology topic you'd like me to cover in a future video, let me know in the comments below. Thank you very much for watching. Take care, and I'll see you in the next video.